Hey guys, hip external rotation, let's get into it. If you don't understand PAILs and RAILs, controlled articular rotations, please go into my previous videos to understand the underlying principles of functional range conditioning. But let's get into the class. Okay, let's warm up with hip cars. If you don't understand how to do this, please go into previous videos of how to do our hip cars. We can do this in different positions. Today we're going to do this in a standing position. Again, breathe in, irradiate. Really important that we do that. We create full body tension. And then what we want to do is go into hip flexion. Come up as far as we can. Now we abduct. We kind of create the biggest circle possible. And we come into internal rotation. And we extend back as far as we can in extension and back into that neutral position. We don't want to be compensating through our spine. We just want to be working that focus joint, our hip joint. Then we come back, we extend, find our roadblock, then we external rotate. We fight for external rotation, going back down into that neutral position. Let's do this from the side. So breathe in and irradiate. Come into flexion, we go abduction. Now we start to internally rotate, fight for internal rotation, keep fighting for that internal rotation as we extend back, slow and controlled in the pain-free range. Neutral position, now we're coming back into extension, find our roadblock, then we go into external rotation, fight for external rotation, biggest circle possible, and come back down into that neutral position. Okay, let's do 4 reps on each side. So breathe in and irradiate. We're searching for the best possible movement, the movement that we have ownership over, and active motor control over. Slow and controlled, pain-free range. This gives us a baseline of our hip mobility and where we're at and what we need to work on. It also gives the nervous system information, gives nutrients to the joint, helps us maintain our range of motion, and helps us to have that active control in our outer range, opening up more mobility health. And last one. So going into our last one, internally rotate, fight for internal rotation. And then we come up into extension, coming around. Fantastic. Okay, let's do the other side. 4 reps, breathe in and irradiate, coming up into hip flexion, abduction, internal rotate. Good. Extend, externally rotate, coming up. Try not to compensate with other parts of the body. Slow and controlled. Great, amazing. Okay, let's get into our external rotation base. I'm going to work on my left hip. We want to get into that 90-90 position. I'm also going to bring my other hip, my right hip, into that 90-90 position. Ideally, we want to keep that position, but if not, this one here, we can bring and change here, just be in a comfortable position. when we're trying to get a stretch in external rotation, we want an anterior pelvic tilt, okay? So coming forward, finding the line of tension. If we're not finding a stretch there, then we can place our ankle up on a block, and then that will increase that stretch. But if we can't get into that position, then we need to elevate our sitting position using blocks. So if we sit on those blocks, get into that external rotation base, we may need some blocks to prop ourselves up so we're comfortable. And then what we do is anterior pelvic tilt, coming forward, finding the line of tension. So today I'm just going to use one block to elevate me. I'm going to get into my base, 90-90, 90-90. Good, I'm feeling comfortable. Making sure that we're not compensating too much for the back. We can sit up straight and coming forward into this anterior pelvic tilt and find the line of tension. I'm feeling a stretch, good stretch just in the glute region there. Let's start our 2-minute timer. So let's just really just rest and try and relax into that stretch, do our breath work here. And let's just go through our PAILs and RAILs cues. So the PAILs contraction is going to be driving my ankle into the floor in internal rotation, really focusing on that internal rotational component of that contraction. I like to hold my hand just on my knee as I drive my ankle down into internal rotation. Okay, that's the PAILs contraction. Our RAILs contraction is trying to make our ankle lighter off the floor. I like to hold my knee on the underneath part of it, and then we're just trying to lift that ankle off the floor. Obviously, we won't be able to because we're in our passive range. That's going to be the hardest contraction, sometimes a little bit crampy because our nervous system and our muscles haven't been in this position before. So it's getting that, retraining that motor control and spatial awareness. Great. Just keep into that stretch. So in 30 seconds, I'll count you in for our PAILs and RAILs contractions. We're going to do those for 15 seconds, safe and best effort contraction. Okay, 15 seconds. Remember, we're driving the ankle down into the floor. Build that up to your safe and best effort. So 5, 4, 3, 2, 1. Driving that ankle down into the floor, building up to best effort, safe contraction. Keep going, keep going. Really push as hard as you can. 3, 2, 1, opposite contraction. What we're trying to do is lift our ankle off the floor. Keep going, keep going. We're going into more external rotation, focusing on that rotational part of it. 3, 2, 1, and relax, coming forward deeper into that stretch. Reset your stretch. Find the line of tension. 45-second stretch here, and then we're going to do our PAILs and RAILs contractions again. Okay, 10 seconds and I'll count you in. Remember, we're driving the ankle down into the floor for our PAILs contraction. We're trying to lift our ankle off the floor for our RAILs contraction. 3, 2, 1, and drive it down. Keep going, keep going. 3, 2, 1. Try to lift that ankle off the floor. Keep going, keep going. keep going. 3, 2, 1, and relax. Stay in that stretch, 45-second stretch here. So if we want to increase the intensity of this exercise, we want to do our longer contractions, 30 seconds, a minute, depending on where you are with your rehab. But we really want to build up to the max intensity with those contractions, that isometric loading, to get the best out of our mobility gains. Okay, so another 5 seconds, and we're just going to slowly come out of this base and do our lift-offs. So our lift-offs, in order to be able to do that, what we want to do is lift this ankle off the floor. So we need to come back in order to be able to do that. So come back and just try to position where we can lift our ankle off the floor like that. So let's do 10 reps, and our last rep, we're going to hold it for 15 seconds. So 1. So really focusing on increasing that external rotation, squeezing as much external rotation as possible. 3, 4, 5, 6, 7, 8, 9, squeezing out that external rotation, and 10. We're going to do this for 15 seconds. Keep going, keep going. This is how we get that spatial awareness, motor control, increase our mobility and spatial awareness. Keep going, keep going. 3, 2, 1, and relax, coming out of that base. Okay, now we want to just swap to our right hip. You might find that your hips are different with the mobility health, depending on where you're at with your hips. One side sometimes better than the other. Okay, so we're getting in the base there. We're 90-90. This leg, don't have to worry about so much. And coming forward, we're anteriorly pelvic tilt. Find our line of tension and get into that stretch that start our timer. 2 minutes here. Making sure we're sitting up straight, just finding the line of tension and just do our breath work and rest into that stretch. Our exhale should be twice as long as our inhale to get us into that parasympathetic state. Stretching is very fight or flight, so our breath work really helps us to relax into that stretch. Great, 30 seconds to go, and I'm going to count you in for our PAILs and RAILs. Our PAILs, we're going to drive our ankle into the floor, going into internal rotation of the hip, and our RAILs contraction is trying to lift our ankle off the floor, going into more external rotation. So really focus on the rotational component of this contraction. Good. 3, 2, 1, pushing down into the floor. Really push. It's the best effort, safe contraction. Keep going, keep going. 3, 2, 1, opposite contraction. We're trying to lift our ankle off the floor. We're trying to go into more internal rotation, or external rotation, I should say. We're going deeper into the stretch. 3, 2, 1, and relax. Just reset that stretch. I'm going to take these blocks off for this one. Anterior pelvic tilt. Make sure you're sitting up straight as well and you're comfortable. This is a 45-second stretch here. I'll count you in for our PAILs and RAILs. Okay, I'll count you in. 5, 4, 3, 2, 1. Drive that ankle into the floor, going to internal rotation. Hard as you can, really push hard for this one. 5, 4, 3, 2, 1. Opposite contraction, trying to lift that ankle off the floor, going to more external rotation, deeper into the stretch. Keep going, keep going. 5, 4, 3, 2, 1. Again, just going deeper into that stretch, finding our next line of tension. 45 seconds here, and then we're going to do our lift-offs. Right, 5 seconds. 3, 2, 1, staying in that position. And now we're just going to back off, going to posterior pelvic tilt so that we can have the ability to be able to lift our ankle off the floor. There we go, I can get it there. So we're gonna do 10 reps. 2, 3, squeeze out that external rotation. 4, 5, 6, 7, 8, 9, and 10. We're going to hold it for 15. 10, holding, keep holding, squeezing that external rotation. Keep going, keep going. 5, 4, 3, 2, 1. Slowly release and slowly come out of that base. Fantastic. All right, hip cars. Let's get into on all fours. We breathe in and irradiate. We come into hip flexion. We then go into abduction and internal rotation, searching for the best possible range, searching out for the movement that we have ownership over for just our hip joint. We don't want to be moving other areas of our spine to get this movement. So we don't want to be compensating. We just want to be moving this hip joint. So slow and controlled, searching for that space, creating the biggest circle possible. Good, going to hip flexion. We then internally rotate, abduct, search for that space, fight for internal rotation and extension, then going back into that neutral position. We then extend back, find that roadblock, then we externally rotate, fight for external rotation. What space do you have ownership over? That's what we're asking. Great, we want to do 4 reps on this side and 4 reps on the other side. Great, last rep, going into flexion, abduction, internal rotate. Fight for internal rotation as you're coming up. Try not to compensate through the back, going to extension, back into our neutral position. Into extension, find our roadblock. Now externally rotate that hip. Fight for external rotation, coming up into flexion and into our neutral position. Okay, so let's do our other side. 4 reps on this side as well. Great. Breathing in and irradiating, coming up into flexion, abduction, internally rotate. Really search for that best possible space without compensating other areas of our body, especially our spine with this one. Great, just really slow and controlled. It's not how fast you do it. We just want to search for that space, get into that outer range. What movement do we have ownership over? Our CARS allows us to know it's the base or the foundational exercise for our hip. This is a representation of what the joint can do and gives us ideas of what we need to be working on, and also our mobility health as well. Great, that's 4. Well done. Okay, capsular CARS, we want to lay on our back for this one. Bringing our leg up into that 90 degrees, our hip, and then we internally rotate and externally rotate. So just slow and controlled. Now we've opened up that space with the PAILs and RAILs contractions and stretch. We now just want to internally and externally rotate. Give our joint capsule and nervous systems that information about that space that we've just opened up. Okay, last rep. Really try and squeeze out as much internal and external rotation as we can. We go to the other side. Again, internally and external rotation. Okay, last rep, squeezing out that internal and external rotation. Great. So we want to see how we pull up after our PAILs and RAILs contractions and when we're in those bases. If you're pulling up a little bit sore, we know we just want to decrease the intensity with the depth of the stretch and the intensity of the contraction. But if you're feeling great, then we know that we can go that extra level of intensity, and we want to go best effort, but safe contraction and safe intensity. So we just want to build this up over time. We want to get a re-education, adaptation of those tissues. We want to get active control and better mobility. So let's give it a go.